Hi, I'm Dr. Tieche from Recharge Clinic, and I've been asked lately a lot about PRP, or Platelet Rich Plasma, for facial aesthetics. And so we've been using PRP for lots of things, for lots of ligament and tendon injuries in the shoulders and the knees, feet, every place we've injected that. And as we know, or as you don't know, maybe, PRP comes from our blood. We take a sample of our blood and we spin it down in a centrifuge and we isolate the growth and healing factors that are separated in that centrifuge. There's more than 1,500 bioactive factors in that. So that's pretty cool. There's a lot of those factors that we're going to use that are made in our body, concentrated, and then we're going to reuse back in our body to help heal and stimulate things. So previously it had just been used really from the neck down. Now we're going to talk about some applications from the neck up. And so from the outside in, one of the things that PRP is done with, it's used in conjunction with microneedling. And microneedling is where we use a device to make small punctures into the dermis to help stimulate collagen. If we use PRP with that, it is applied topically, and then when that needle makes those punctures, it drives those factors down into the dermis to help stimulate collagen and help the skin kind of regenerate itself. It's an amazing treatment. It really helps with acne scars and just smoothing over the contour of someone's face. Now we're going to talk about some places that you can inject it under the skin in the face to help stimulate collagen and do things as well. Pretty much it can be injected everywhere under the face. And so some of the main areas that we use are for dark circles. And we put that underneath the eye. There we abstract the PRP and we use a cannula needle to place it under the eye to help stimulate that tissue and get rid of those dark circles. And it's very effective for that. Some of the other options are for that are filler, but this is a little bit less invasive one and what some people consider a little bit more natural. It's also used to treat smile lines that may be very deep, that have not really responded to things like Botox and Dysport. Another area that we can use is people have very deep lines here in their glabella, and we can put PRP in there to help stimulate that tissue, stimulate the collagen to grow, as well as forehead lines that have, again, not been as responsive to PRP and Dysport as we'd like. Another big area that we use it in is the cheeks. And that's almost called a PRP facelift, really. We and put it all under the tissue there, and it really helps rejuvenate and stimulate that tissue. Because as we get older, we lose a lot of fat under that skin there, and it causes the skin to sag and just look a little bit hollow. So this helps stimulate that tissue in a very natural way. As we work our way down, nasolabial folds. This is another perfect place for PRP. We start getting these creases here. One of the options is to put filler in there, but if you use PRP, it's yet another safe and natural way to do that by applying it in this area. The other thing is some people develop what are called marionette lines below here, and that's another way to stimulate tissue in that area. And then we go to the top of the head, and PRP is used to stimulate hair growth in two different ways, both topically with microneedling that it drives it in, or that PRP around the hair follicles to help stimulate growth and to help rejuvenate that tissue, or with little micro injections into the scalp to do the same thing, to deposit that PRP in that dermal layer to help stimulate the follicles. It's also used in the neck area to regenerate that tissue. As we get older, we start having more crepey skin in this area, and it helps make that tissue look a little bit more youthful. So I just wanted to go over some places that we can inject PRP from here up, and you can see it's used quite extensively with really pretty amazing results, and most importantly, it's very safe. There's never been a reported reaction from PRP because it's from your body going back into your body.